Good evening. Today I will be informing you of diabetes mellitus. I know a lot of you all are wondering what is diabetes mellitus. Well, I've had a personal experience with this disease since I was a child because various members of my family has this disease. My grandmother died from this disease. Diabetes mellitus is a metabolic disorder in which the cells do not take up glucose properly, which causes complications throughout the body. The cause of diabetes includes environmental factors and genetics, such as obesity and lack of exercise. Approximately 23.6 million people, including adults and children, or 7.8% of the population, have diabetes in the United States. 17.9 million people have been diagnosed, and 5.7 have not. There are two ways in which one can be diagnosed with diabetes. One of these ways is the fasting plasma glucose test, and the other one is the oral glucose tolerance test. If one's level is less than or equal to 110, it's considered normal. If one's glucose level is between 126 to 140 or higher, they're considered a diabetic. A diabetic is one who has been diagnosed with diabetes. If one's glucose level goes too high or too low, they can go into a diabetic coma. There are three types of diabetes: type 1, type 2, and gestational. Type 1, also known as juvenile onset diabetes, which is an autoimmune disease that destroys insulin producing cells and requires insulin injection. 5 to 10% of Americans have type 1. Type 2, also known as the adult onset diabetes. In type 2, target cells do not respond to insulin, which leads to insulin deficiency. The resistance of insulin causes a condition in which the body fails to properly use insulin. The majority of Americans have type 2. Gestational diabetes affects approximately 4% of pregnant women and prolongs sometimes after pregnancy. There's also a disorder called prediabetes. Prediabetes is when one's glucose level is higher than normal, but not high enough to be type 2. Approximately 54 million Americans have prediabetes. There are many risks that can cause diabetes. Some of the risk factors are being 45 years of age or older, weight, race, lack of physical activity, a condition which causes dark, thickened skin around your neck, on your armpits, high blood pressure, giving birth to a baby 9 pounds or more, and etc. Diabetes causes complications with the eye, the skin, the kidneys, the heart, the blood vessels, the hands, the feet, and so on. Everyone over 45 years of age should have their glucose tested at least 3 times a year because the risk increases with age. Some of the symptoms of diabetes are frequent urination, excessive thirst, extreme hunger, blurry vision, irritability, unusual weight loss, increased fatigue, and etc. One can prevent getting diabetes if they change their diet, increase their level of physical activity, and maintain a healthy weight. With these positive steps, one can stay healthier longer and reduce the risk of getting diabetes.